All right. Well, Suzanne, welcome to the Unfiltered Healing Podcast. We're excited to have you on today.
Thank you. I'm excited to be here.
Yeah, I'm actually super excited about this conversation because you were actually one of the first people that started to introduce me to tongue ties and tongue position. I know that I did, some one-on-one work with you, and you really started to open my mind about how important the tongue is, how important tongue position is, and how you're swallowing and breathing and eating. And so I'm really excited to have this conversation today to get, and talk a little bit deeper about that because I know it helped me so much and it has helped, several patients that we've co-managed and worked with as well. So um the listeners already have a little bit of your background that I mentioned initially. So what kind of because your background is a dental hygienist, right? So
Right.
what started to drive you in the direction of focusing on like tongue position and mouth? Like, did you always have that focus, or was this something that developed during your work as a dental hygienist?
So, no, I didn't always have this focus. I, in fact, didn't even know about myofunctional therapy 10 years ago. Never heard of it,
Mhm.
nothing in our schooling or our background, anything. So, but I always wondered, why um, these patients looked the way they did. I mean, their mouths, their high palates, their tongues, their teeth. What's happening with their teeth? And why is this happening? And it just got me down this rabbit hole, which it's pretty deep. And I'm always
Yeah.
learning, always studying. But I've been in thousands and thousands of mouths by now, after all these years of being
Mhm.
a dental hygienist, and it all makes sense now. And I look at things completely different.
Yeah. So, what were some of the things that you were kind of noticing when you were working? Was it specifically like the tongue tie, or were you just like, man, there's something that I'm like, what was the biggest thing that you felt you were missing? And then what sparked that to learn this stuff?
Well, I think the biggest thing that is being missed is sleep and airway problems with
Yeah.
patients. That is the biggest one of the biggest things, and tongue tie is all related to that. So I think it's still being missed. There's only a small portion of dentists and pediatric dentists who are looking at these things.
Hmm.
Um, like in Brazil, when babies are born, they do an automatic tongue tie screening and they release the tongue right away, just as a part of the, postnatal
Yeah.
care or when the baby's born.
Yeah. And so, as an adult, then if that's left undone, then you're seeing all these types of patterns, right? See patterns with
Mhm.
airway,
So I
patterns with,
see,
yeah, go for it.
yeah, I mean, TMJ problems, patients grinding,
Hmm.
gagging, mouth breathing. There's so many things, ADHD, and a lot of it goes back to the sleep. If you don't sleep well, you get these symptoms, but it could be related to a tongue tie for sure.
Yeah, did you have any training, like, when you were doing dental hygienist, work primarily? Because now I know you're just primarily myofunctional therapist. Did you guys have any specific training for these types of things, airway? Because a lot of the dentists that I talk to that are now functional, they just had 0 training about that. Is that similar to what you had as well?
Yes, I went to school. I graduated in 1984, and the thing I guess that we were focused on mostly was like HIV and hepatitis, and as far as patient care goes, but
Mhm.
um, nothing, nothing,
Yeah.
unless I forgot, but never. And the
Yeah.
dentists don't have it either.
Right. And so if you don't have the training, then you don't really know what to do for it. So, but I do believe that
So it's all
now,
close.
yeah, and I do believe that now, I mean, just in the past recent years, and it might just be because now it's on my radar as far as like people I follow or things I'm listening to. I'm hearing more and more people talk specifically about tongue ties. So is it that they are getting more recognition now? Because I know that can go two ways, which I'll talk about in a second. But do you feel like it is getting more recognition now, or do we still have a long way to go?
Well, it's getting more recognition, but we still have a ways to go. And tongue tie goes back to the 1600s
Mm.
when the midwife would deliver the baby. She had a long pinky finger, and if the tongue was attached or adhered too closely, or to the down to the bottom of the mouth, she just took her fingernail and broke that. So it's been around a long time.
Oh my gosh, I didn't know that.
You didn't know that?
Just need
And
a
then I
sharp
was just
fingernail.
I know, right? Um, yeah, I may I just do it myself.
A
And
lot
so,
of things
yeah, and
needed to go
the nursing journal. I know. And I just read something about the 1700s, like in nursing journals, and then it kind of went, unrecognized for a while. But we're
Mm,
because of airways getting so much attention, this tongue ties is also because it's a cause of it. So we are screening more for that.
yeah, yeah, and I know that you primarily work with, like, you don't work a bunch with, like, babies, but you do work with some children and mostly adults, right? That's your current
I
practice.
work with a probably 50-50, probably half adults, half children. The little ones, I'm going to, start doing a little bit more with the younger ones to support, to be there for the moms.
Yeah.
So I'm actually working on that now.
Yeah, yeah. Because the proper screening, excuse me, is young. It's a baby. It's, they develop all those patterns. And then when individuals maybe are like, I don't even know what a tongue tie is. So let's talk about that first. Like, what is a tongue tie? And then we can get into how that, portrays as symptomology in someone. So kind of break down what a tongue tie is, and then we can develop off that.
Okay, so in our mouth, we have 7 different frenums. Okay, so we have 2 on the side, top and bottom. Then we have 1 on the lower lip, 1 on the upper lip, and 1 under the tongue. So the ones that affect most, like say baby feeding and breastfeeding, bottle feeding, all that stuff, infant things, are these 3 right here. Okay, the lip, the
Mhm,
tongue, and the lower lip. So it is a connective tissue, or it's a tissue that attaches the tongue to the bottom of the mouth. So I have a glove here I wanted to show you. So
mhm,
you could either be attached here to the bottom, so the tongue is just stuck down there, okay? Or it could be
mhm,
further back, but the tongue is still stuck down there. So we need the
mhm,
tongue to go up on the palate, to live on the palate, to expand the palate as a child. So if it's stuck down here, how's that going to work? And if anybody wants to try it, attach your tongue or just touch the bone in the bottom of your mouth and leave it there and try to talk, eat,
yeah, 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 yeah.
swallow. It's really hard.
It's really hard.
So it's very tricky. So and it's usually so it is some tissue, and to release it is either done with the scissors and stitches or laser, CO2 laser. Takes literally 30 seconds to do,
Mhm.
um, to get that. It's such a simple thing. And I always say, circumcision is way more complicated than that, or ears
Yeah.
piercing, as opposed to, just doing a small release on the tongue.
And how common is an actual tongue tie? Because, you can have the tongue, you can have, like, some of those other ones that we talked about as well, but usually the most pressing one is the tongue. How common is it for individuals to have a tie?
Well, so it can be up to 40%. I just saw by a tongue tie doctor,
Mhm.
but usually they say maybe 15% of the population, and then over 80% if you have a tongue tie is usually a lip tie as well.
Right, because they usually go in
So
pairs.
they usually have both. Right,
Mhm.
right.
So, if someone has so for instance, if someone has a tongue tie and they've got that tongue restriction going on, what are some things that that child, for instance, if they didn't get it released, may develop? So we know that it stimulates the palate. What are some other things that could potentially happen if left untreated?
Well, and let's also look at the signs in an infant, first of all. If you're
Yeah.
trying to breastfeed your infant, if they're falling asleep on the breast, if you're getting the clicking sounds, if the baby is feeding for a long time, multiple feeds for a long time, if the latch is poor, if the mom is having pain and sore, very sore, bleeding, cracked nipples, we usually see the blisters on the lip from the pressure, and so that's what it should. Oh, a lot of GERD, like spit up,
Mhm.
or just issues like that, and that tongue being tied down will also hold the lower jaw back from growing forward.
Mhm.
Okay,
Mhm.
so and you see now infants in utero with their recessed lower jaw while they're just inside the mom's belly. So that's what we see in infants. So when that's happening, we tried IBCLC, some body work, chiropractor, CST, to try, in addition to the tongue tie release, to get that feeding better and get rid of all those symptoms we were just talking about. So in children, if it continues, they become picky eaters.
Mm.
They gag easily on their food and drink. They ADHD symptoms, also that retruded lower jaw, and now that the tongue can't go up to the palate, the teeth are crooked. There's no spacing between the baby teeth. We want the baby teeth to have spaces all in between them. So there's a lot of things that are affected by not having that tongue tie released, and then it goes into
More
older people
cavities
too.
too more cavities too, right? Don't they, like, more
Right.
prone to
So
cavities with tongue?
yeah, so there's two reasons for that. Usually mouth breathing. So if the tongue is low,
Mhm.
the mouth is most likely going to be open. And then second, and that dries out the tissues and changes the makeup of the oral cavity. And then the other thing is the tongue being restricted can't like self clean in the corners back
Mm.
behind our teeth. It can't get the food out from all the little vestibules and crevices in between the teeth and that kind of thing. So, and then with the lip tie, we see sometimes decay on these front teeth here because food and bacteria get stuck up there.
Mhm.
So,
Yeah, there's not as much
and
space.
then, yeah, right, right. So, pretty interesting.
Yeah, yeah, and so before we talk about adults, with the what is kind of your because I have a different type of experience when I see little ones with tongue restriction and stuff like that. Um, Now there's, like, a trend to have every tongue tie removed, even if it's not a tongue tie. So that can
Right.
go that way too. We try to educate people, like, these are really significant things and really significant findings when it's true. But also there can be then there was a trend to, like, do it on every single baby. So there's a time and place for it as well. But if this is a really
Hmm.
thing, it can completely change the development of the craniofacial structure with the tongue.
Yep.
Um, so if that child, like you mentioned, has some of those things growing in development, then what about as an adult? What tends to happen as an adult?
So it doesn't go away, obviously. And they learn how to compensate with different muscles. They get myofunctional disorders there because they're compensating, trying to move other muscles to get their face and mouth to work properly. But we also, like I said, back to the, ADHD, we see grinding, we see that tongue, and because it's forward and low, it can also take up some of that airway space as well.
Mhm.
So, speech issues, kids, well, even kids and adults have speech issues without compensating and their jaws moving all over the place because the jaw and the tongue are kind of attached. So
Yeah.
now you're getting the jaw moving and it's also causing TMJ problems. So it can be a lot. What I usually do is I measure and then I look at the symptoms and then I tell the client, we're just going to put this on the back burner. Let's try the myo and see how it goes before we rush into doing it. And
Mhm.
sometimes things get better without having to do the release. So
Yeah. Yeah.
I
So
take everybody individually.
yeah, let's transition into that then because some people might not know what myofunctional therapy is. And if an adult, for instance, didn't know they had a tongue tie and they're listening and they're like, oh my gosh, I think I have a tongue tie. There is a point that we want to make is that if you are an adult, like Suzanne just said, you developed all of these patterns now because you're used to having your tongue and restricted. So it's important as an adult to start working on a lot of those patterns before getting a tongue tie removed. And that's what myofunctional therapy does. So why don't you talk a little bit about what myofunctional therapy does and why it's important to look at those patterns, what those patterns are, and then work on a tongue tie release if you have it.
So myofunctional therapy is we work on the muscles of the lips, the face, and the tongue. Okay, and it helps with a lot of things. It helps to tone the tissues of the airway also, which helps keeps the airway open at night. So it is a series of exercises done in intensity, frequency, and duration. So 3 times a day to start working these muscles and then getting like using the proper muscles for what you're supposed to be using them for. So that's what that is. And then before we do a release, it's recommended maybe 3 to 4 visits of myofunctional therapy prior to the release and 4 to 6 visits after. And I can explain all that if this is the right time.
Yeah. Yeah. Um, I remember going I remember going through that program. There's lots of fun things that you get to do. It's kind of I mean, it's basically like physical therapy, but it's for the face and neck and mouth, right? So, how
Right.
would you say, like, roughly, most people do not have good oral position? Is that, like, a safe statement to say? Tongue tie aside, would you say that a good majority of people don't really have good tongue position or jaw position?
Yes, yes, I would definitely say that. So when babies are born, okay, and they're not tongue tied, when they cry, their tongue should go up to the palate and should be up there all the time. And so whatever happens, maybe they get sick or maybe like congestion, and then they start mouth breathing and that tongue goes low and it may not even be tied. And then it just continues on from there, but really your whole tongue is supposed to rest on your palate, the roof of your
Mhm,
mouth, not touching your
mhm,
front teeth. So
mhm,
that's where mine is. And so my goals in myofunctional therapy are proper tongue rest posture day and night, proper chewing and swallowing, which is super important, with the tongue position and what it does to the teeth and for stability. And I want
Mhm.
nasal breathing all the time. So lips closed, tongue up, nasal breathing. So those are my goals that
Yeah,
I work with everyone.
to get those proper patterns. Yeah, because you can imagine if
Correct.
someone is like a mouth breather and then they just go get their tongue tie revised, but they didn't change any of the pattern, then they're probably not gonna feel much different, right?
Right, right. Well, they're first of all, they're not prepared for the procedure, so they don't even know where their tongue
Yeah.
is supposed to go. I kind of feel like this about nasal surgery too. Like a lot of people
Mhm,
get nasal surgery, but they don't teach them how
mhm.
to breathe through their nose. And like I would love to tell every ENT or everyone that does, you need to teach these patients how to breathe through their nose and get their lips closed. Just,
Yeah.
because if you don't breathe through your nose, you become congested and stay congested. And then, you have to learn how to do it and constantly tongue posture and nasal breathing all the time.
Yeah, there's lots of things that happen with nasal breathing, even in the brain, you exchange oxygen. You really are just supposed to nasal breathe for the majority of the time, all the time. Um,
Mhm.
so then how common is mouth breathing? Because that's a pretty, like, when you're screening people for airway issues, right? That's definitely one of the determinants is mouth breathing or snoring, which is another one. Um, is it pretty common that a lot of the people with airway compromise are automatically going to be mouth breathers or vice versa?
A lot of them are, and it's because their
Mhm,
faces grew as mouth breathers, so the lower jaw is retruded. So I would say yes, a lot of the patients with issues are mouth breathers. Yeah.
mhm. Yeah, and what does mouth breathing lead to?
So you're not getting proper air through your system. It's going in through your mouth. It's unfiltered. It's cold, and it's not volumized. So by breathing through your nose has a filter, and it
Mhm,
filters the dirty air,
mhm,
and it also moistens the air, warms the air, and volumizes. So, like when I work out,
mhm,
I have like a poker face, and like the instructor will say, "You breathe, make sure you breathe." I'm like, "I'm breathing. I'm a nose breather. My mouth's
mhm.
never open." So, and like we were talking about earlier before we went on, I mean, I think that all these things are playing a factor in our health for sure.
Yeah, I mean, in my profession, airway compromise is huge. It's like, chronic fatigue and just people who have chronic things all the time because they're nervous. It makes their nervous system go in hypersympathetic drive all of the time. Um,
Mhm.
and, they're not getting proper oxygen, they're not getting that exchange. And so as we change, the cranial system and move that, again, we have to change the pattern. A lot of this is stuff you actively have to do to retrain how you breathe. But that's impressive.
Mhm.
Like, it took me a while once I fixed my airway to be able to nasal breathe while working out. But like during heavier times of working out, I still will mouth breathe a little bit just because I feel like I can't exchange as much. But that's pretty impressive that you
Yeah,
can.
it's definitely, I might have to take a breath here and there, but nothing like it used to be, you know. But wearing the masks all the time as well is causing a
Mhm.
lot of people to start mouth breathing as well.
Yeah.
And another thing I notice is I talk a lot, you talk a lot in our jobs, teachers. So we kind of sneak mouth breathing,
Mhm.
because it would be an awkward pause
Yeah.
to breathe through our nose while we're talking or teaching.
Yeah, yeah, so that's interesting. So, with the mask thing, because I see it stuff with, like, pulling on the jaw and stuff like that, but you have actually seen like, current patients that you had or just new people coming in, and then the masks, you're seeing
I
a
just
more predisposition.
I hear from the dentists. I'm on like a lot of different groups and stuff, and I'm hearing from the dental hygienists and the dentists that, you know, because of the masks, the periodontal disease is worse. Mouth breathing is more, which is causing these things. A lot of decay, a lot of dental work. I mean, the dentists are very, very busy right now, doing a lot of restorative
Yeah,
work. So, mhm.
yeah. It not only, like, facial recognition, but it changes, like I mean, it's pressure on your face too. Pressure pulling
Yeah.
depending on how tight it
Yeah, I
is.
just wear those
Yeah.
small I just wear those little light ones because I don't want that pressure. I had a patient the other day, he had a scab on his nose from the mask, and that is like a chronic irritant. You got to be careful of that too. We know that.
Mhm.
So it's this is taking its toll, as you know.
Yeah.
But
So
and it, and it puts pressure on the kids' little faces and jaws too. And so just makes it difficult and growth. We don't know what the result is of wearing a mask for a year or 2 years or however in kids right now.
yeah, I think, when the research comes out, we're gonna see big changes in that, but I've heard stuff like that too, just as far as, like, expression and brain development, not being able to see how the face expresses in children and things of that nature, and that's a whole, like, different dimension, but also just, mouth breathing because there's pressure on your nose from a mask makes sense too, as far as affecting your breathing.
Hmm.
Um,
And I,
so
I think that go ahead. I was going to say, I think teachers are a great resource to find these children that are mouth breathers. They were before the masks. I'm working with teachers now to educate them on the red flags to look for airway, tongue tie, mouth breathing, all that stuff. But if everything is covered up, they can't even screen. But they're with the kids 8 hours a day, so they're the ones that they recognize things more than the parents do.
yeah, because 'cause they're with them all day, for sure. Yeah, that's very interesting. Just a lot of challenges for lots of different things.
Yeah.
Get them off those kids. Um, well,
Mhm.
okay, so let me shift for a second. So, we know that nasal breathing is super optimal. Um, if someone has difficulty nasal breathing, obviously, we would want them to work with you and other types of professionals. Um, would that be something that they would be able to achieve with myofunctional therapy, is being able to effectively nasal breathe?
Mhm. Yes, absolutely. And it all goes together. I mean, my patients are the ones that I work with are all, lips are closed, but it takes time. It doesn't happen overnight. And, they're thinking about me all the time. It's having me on their mind saying, get your lips closed and your tongue up, all the time. Even when they're on vacation, I have them thinking about it. I give them things to do to think about, while they're on vacation. So, it can be achieved, but we have to get them to be able to breathe through their nose, get rid of the congestion, get rid
Mhm.
of, you know, get it. Sometimes evaluation by an ENT is needed to
Yeah.
see if there are any tonsils, adenoids, anything that could be blocking, any blockages in the nose, anything before we can work with them, sometimes.
Yeah. And additionally, I think with adults, one of the most common things that I see are like TMJ and neck pain. Um, and that's mostly because the tongue is so down and forward in that position. So kind of explain what happens as far as in an adult and they've done the therapy, how is it that they can have relief in the neck and the jaw after having that released?
So, so the tongue rest position, so the tongue being on the palate, if
Mhm,
you all do that and close your lips, the molars are going to be open a little bit.
mhm,
Okay. So we call that freeway space. So that allows all these muscles to relax. Okay. And having that whole tongue up there after the release, or if they need one, having the whole tongue up there allows those all those muscles to relax in the face, the temporalis, the masseters, the buccinators, everything relaxes, and it helps with the TMJ pain and discomfort. We also work on posture. We do posture work too. A lot of times we get that forward head posture that we see in people,
mhm.
and that could be because of the tongue tie, and then it's straining all the muscles of the neck because we know as our head comes more and more forward, it gets heavier and heavier. But are we going forward? Why are we going forward? Well, our whole life now is computers and phones, and so everything, our bodies are growing more forward. Also, the tongue tie is causing that, and then the patient's putting their head forward to open up their airway so they can breathe if there's a breathing airway issue. So it's all kind of related.
Yeah. Yeah, and that's why, like, I mean, I've had some, I know you have because, this is what you do, but I've had some pretty, like, miraculous stories of people actually experiencing during the release procedure, like, their neck relaxed or their shoulders drop down, and that's just because everything is connected and communicates, and so having that,
Right.
I could put their body back into a balanced position, but then they have this extra tissue that's gonna pull them right back out of that position. And so that's what I try to explain as
Right.
well, but it can be super impactful for all of those things, and swallowing too, right? So swallowing is another big one.
Yes. So I was going to say, are you familiar with the deep front line?
Mhm,
So the deep front line of fascia goes from you have to be, but it goes from your tongue down to your toes. And the fascia is this very light, it's like on what's on top of a piece of chicken, not the skin, but it's between the skin and the meat. So it's like this clear or whitish kind of tissue. And so that's all attached. It's actually, they say, all one piece. If they dissect the deep front line, you see it goes, and it starts at the tongue all the way down the chest, the hips, the knee. I mean, every till the to the big toe. So when we work with a patient who has a tongue tie, they need to be prepared with the body work, cranial sacral, chiropractic prior and then after, because if that tissue's all wound up,
mhm.
it it needs to be all loosened up again. So that's why, we all have to work together on this.
Yeah, super important. It's
And
all connected. Yeah, it's all
yeah,
connected, and I
totally.
think that's where some of the problem lies, where some, like, patients coming into my clinic or maybe not doing myofunctional therapy as well, and they come in and, "Oh, I had a tongue tie and it, like, reattached," which is very common, right? Um, or I didn't
Mhm.
really notice any difference, and these are what we're trying to stress is, yes, it's like, can be a life-changing procedure, but you have to have things like bodywork care, myofunctional therapy to be able to actually change that brain pattern to get the full release
Mhm.
of what we're trying to achieve, and that's why it's so impactful when you do all those things and then you release it, it's like, "Oh." Your nervous system is like, "Oh, thank
Right.
you,"
And
you know?
yes, yeah. And as far as the protocols, the worldwide protocols, Dr. Zaghi at the Breathe Institute,
Yeah.
you have to have myofunctional therapy, or they recommend it's highly recommended prior and after the tongue tie release. And I've been, I've, I go with my patients usually for the release, either whether it's up to LA or somewhere local. And I have seen that sort of let down the shoulders. The patient gets a little um, emotional. There's like, it could be an emotional letdown
Mhm.
just by having that tight tissue released. It's pretty amazing. I mean, it's pretty amazing.
Yeah. It's super amazing. I felt that when I had mine done. And it's kinda like it's weird. It's like a kind of a euphoric feeling at first.
Yes.
I don't know if you have
Hmm.
people that say that, but, I know for me personally, when I had it released, I had kinda like my shoulders drop down, and I had so much more range of motion in my neck that it was kind of just like this euphoric feeling. So I don't know exactly the neurology of that, but
Well,
it was nice.
even like but the children too, like this, I remember this one little boy, he got released and he came out of the chair, like without even, like, he didn't know it was going to help his or make him feel better. And he's going like this. He's like, wow, I feel great. And he's a little kid, he didn't realize, he didn't know that that was going to happen. And
Yeah.
so that's kind of innocent. There's no, um, like he's not prepared to say that. He just did it. And the mom's like, wow, look at him. So it does have a big impact.
Yeah, so I don't know if you know this, but I'll ask it because I know as far as with the tongue and cranial nerves, which is what I do a lot with cranial work, is that the tongue has like a huge impact on the vagus nerve, which is one of our very, very calming cranial nerves. And so I know that that's part of it. When you start to release that, the vagus nerve can then work properly and regulate the nervous system. My question is are there other things that you know with just, what you've done that also impact as far as how the body works with the tongue movement?
I thought you were going to say with the vagus nerve. I was going to
Oh,
say,
yeah, Vegas
I
too,
have
go
my
for
patients.
it.
I have my patients humming. Humming helps the
Yeah,
vagus nerve.
mhm.
Um, we uh, any what was I going to say? Um, yeah. So gargling also. So that's part of what I do. We do gargling, and so there are things that can impact the vagus nerve. Um, and sorry, go back. What was the other part of your
And my question
question?
was, like, do you know any other because I know it hugely impacts the vagus nerve and putting the brain in calming mode. Are there other things that the
Hmm.
tongue does as well as far as body function? Do you know?
Um, well, I'm sure I do. Um,
Sorry to put you
mm,
on the spot, it
well,
just came
I
to
mean,
my
I
head.
would say, like I always tell the patients, like the tongue is like the rudder to the head,
Mm,
and it's in
mhm.
control of everything. So if the tongue is strong and in the right position um, on the palate, it helps a lot of the, like, breathing, for example. And the lips are closed. We do diaphragmatic breathing, so it helps. It's all, comes together. It's all connected.
Yeah, and the jaw, I believe, is, like, one of the most used joints in the body, right? It's, like, one of the most used joints, but it gets, like, the most
Well,
damaged.
it's also very unique. I mean, we don't have any joints, other joints like that in our body. So we have this disc, and it's very fragile. I mean, I teach my patients too, like, no leaning,
Mhm,
because,
mhm.
or watch the way you sleep, because this pressure on your jaw, it's really, really fragile. Even extractions of wisdom teeth, the mouth is open for a long time. Orthodontics, I see all kind. Patients have TMJ problems from all that overusage of, just the grinding, constant grinding, side to side, the shifting from a tongue tie usually, because it's all one piece.
Yeah, and the traditional is like, okay, if someone was in pain, because a lot of orthodontists don't pay attention much to the tongue, unfortunately. So they'll just, do traditional orthodontics with a child or a teen, for instance, or an adult. Um, but then again, it's just like someone getting nasal surgery. They still have all of these oral patterns that are there and are not very functional. So why?
Right.
Because there's not a whole lot of myofunctional therapists, right? I think it's growing field, but there's really
It
not
is
that many,
growing.
right? Okay,
Right.
it's
And
growing. Well,
and
that's
and
good.
in my opinion, it's not just because of I do it, but I have learned and seen over the years that every patient who needs orthodontics should have myofunctional therapy. Okay? Because myofunctional therapy helps get stability by having the tongue in the right position. So now we see a lot of our patients getting Invisalign after they've had braces once. Now their teeth become crooked again. So there are some savvy
Mhm.
dentists out there and orthodontists who refer for myo, but because they realize that, okay, well, the teeth got crooked for some reason, could have been a tongue tie, could have been just the tongue thrust never corrected. They never corrected what caused the problem to begin with. So if the orthodontist or the general dentist is referring for myo, they're on it, and their work is going to last a lot longer. They really and that's if they're even aware of it. I mean, that's part of it too. They a lot of dentists don't even know what myofunctional therapists are, or and orthodontists.
Right.
I have a wonderful periodontist who refers me patients because the tongue thrust is causing periodontal issues. The mouth breathing is causing periodontal issues. It's or you put an implant, somebody gets an
Mm,
implant. If they're thrusting on that implant, it's never going to stay stable in that bone, that constant pressure of the tongue all the time. So it affects a lot of things, a lot of things.
yeah, the mouth is like
And
Pandora's box.
yeah, it is. It tells a lot too.
It tells
When you
us
see
so
you,
much.
it tells a lot.
It tells
Yeah,
us so much, and
absolutely.
I didn't know that about the, implants, so that's really interesting, but it makes perfect sense. Um, is it
Mhm.
pretty common for, because tongue thrust, like, doesn't that happen more commonly when the child sucks their thumb or something like that? Because it pushes the tongue forward, or just it doesn't even matter?
Well, you just got to figure why is the tongue trying to come out of the mouth? Well, is it an airway issue? Do
Mhm,
they need a CBCT scan to see how big their airway is? It's happening for a reason. Okay. And so that's why sometimes I have my patients go get a scan, see what's
mhm,
going on with their airway,
mhm.
because it could have a tiny airway and the tongue is pushing forward to get out of it, to get out of the way. So
Interesting.
um, that's yeah, isn't that interesting?
Yeah.
Um, and so a lot of my patients, on top of some of the other things that they have a tongue thrust. So that must be corrected in order for the teeth to stay straight after braces.
Yeah.
So I see patients, before they start Invisalign, during Invisalign, but the tongue is a very strong muscle and it trumps the bone. I mean, it changes the bone. You see the faces the way they grow. It's because of the tongue. So the tongue is always going to win
Hmm.
at the expense of the teeth, you know, the growth, the jaw, the TMJ. That's why
Yeah.
it's important that it's doing the right thing.
Yeah, and I can speak to that personally because before I knew all this stuff, as a teen, I first got braces and they totally messed up my mouth. I mean, I had a tongue tie, had all that stuff we talked about. And then, you have to wear a retainer and you have to do all this stuff so the teeth don't move, but then developed massive clenching and all of this stuff. This round, because things were done very functionally, and I did the myofunctional, I did the tongue tie release. Um, my tongue automatically knows where to go. I don't mouth breathe anymore. You know, all of these things, this round of braces is just, it's totally different. And I only got braces to fix my airway, so there's a difference there. Um, but it's totally different because my teeth are now kind of like the orthodontist who's functional will guide the teeth, but then the teeth will actually move more functionally around like where my tongue and position is going. So there's not like this huge like force of pulling something in a way where now my body's trying to pull it the opposite way. And it's been, I mean, it's still painful, but it's been totally different in that sense. And that's why we try to get young kids to do these types of therapies and stuff, so they don't need this type of work, you know, later on in life. So
Right,
much of that can be avoided.
right.
But it
Yeah, and you know, I have patients who've been through jaw surgery too, Rachel. I mean, it's incredible. You know, double jaw surgery. If they would have had the tongue tie fixed and the myofunctional therapy, probably could have avoided double jaw surgery, which is pretty serious, pretty significant, metal plates and all that stuff. I
yeah,
mean, well, you know, we have a couple patients in common that we're, you know, looking at these different procedures and
yeah, so many of it starts so early on. That's why we stress all of this type of stuff
Mhm.
is early intervention.
Yeah,
You can stop all
right.
this,
So I'm
but
getting ready to do
still a lot of hope.
Yeah. No, I'm getting ready to do a presentation on the first 1,000 days of life. I haven't started it yet, but I'm committed to doing it. I am going to show how we can affect just from birth to 3 years
Mhm.
myofunctional to help to avoid myofunctional disorders.
Mm.
So, to know how that goes.
Yeah, that sounds super interesting. I wanna watch, is it
Yeah.
like a live
And
event
it's going to be like a webinar, yeah,
or
or some
webinar?
kind
Yeah.
of presentation. But you know, you can by first of all, as an infant, you want uh, breastfeeding if possible,
Mhm.
and they want to try to breastfeed if possible. If not, that's fine. They have nipples that are more naturally shaped for bottles that are better for the development of the mouth.
Mhm.
The pacifier. You want to stop the pacifier before a year because that shapes the shape of the mouth. It shapes the shape of the teeth. I mean, sometimes there's an open bite because that plug is stuck in there.
Yeah.
Okay. That's hard to correct. It's hard to correct orthodontically. Okay. So there's a lot of education that could be done. The types of cups, the types of straws, the types of things. How about having kids use their jaws and chew food, chew like chicken and vegetables, like not all these smoothies and yogurt and soft foods, chicken nuggets. I mean, they need to be using their jaws by, you know, baby led weaning starts, they say, recommend like 6 months to start really using their jaws and not all these soft foods. So that's the reason why our jaws are starting to get smaller and smaller, is they're not getting a
Mhm.
workout. They're not, you know, they're not getting the work that needs
Yeah.
to be done. And
Yeah, they have all those pouch foods now,
I know,
all the
I know,
liquefied foods.
I know.
Which are delicious, but
So
again,
then
yeah, they
they don't have to do anything. They just,
yeah.
you know, squeeze it in there and swallow it, you know. So, you know, the teeth and muscles of the face and the jaws aren't being utilized the way they should be.
Yeah,
So,
I just wrote about this too in a section, but I know Weston Price talks a lot about more nutritionally related too. So that's not like what we're really talking about, but I just like to mention it because he talks a lot about, like Aborigines and they didn't really have much of like dental issues just because of diet. So yeah, absolutely, like breastfeeding and stuff like that, and then the binky and all of those things, but also, like you mentioned really early on in our conversation, was also congestion can help them develop to be a mouth breather. And a lot of the baby formulas are super inflammatory because 'cause they're filled with soy, and other things, and that develops mouth breathing as well. And so, diet does play a huge role in chewing, and all of that stuff plays a huge role in the development of our face. Um, and so, yeah, I love it. All of those things are super important, diet as well as the more mechanics of what actually needs to happen with the facial structure of the tongue and all of the bite as well.
And also, Rachel, the environment. I always say the three Ds: dairy, dust, and dander. Those will cause congestion, and or sleeping with the pet, the animal, the family dog or whatever, who's got a lot of dander, a lot of fur allergies. The cat, the
Yeah.
Dr. Mew talks about the boy who's, his face was developing into a handsome young man, maybe 8, 9 years old, and back in England, they bought him a gerbil or a hamster. They put the cage in the bedroom, and he developed an allergy and started to mouth breathe and couldn't nose breathe at all. And his face completely changed and developed that way. So we talk about the dairy for inflammation, and then any type of dust and dander.
Yeah, I actually have a patient that
So
happened to. He's an adult now, but he basically told me, he showed me pictures, like, early on, and then they actually it wasn't, animals, it was moldy house, because most dust is actually mold spores, and so, he said he didn't know till after the fact, but he lived in a moldy house, and then he developed the, mouth breathing in this huge elongated face, and that's what we see with mouth breathers, so, yeah, and environment's also a huge player in being able to breathe.
mhm.
So,
Yes, yes.
I love it. I'm
I,
excited
I
to
um
watch your webinar. That sounds really interesting.
I know. Yeah, yeah. I'll see how it goes. I'm sure it'll be fine. But back to the palate. The palate, or the roof of the mouth, is the floor of the nose.
Yeah,
So if you have that high narrow palate from thumb sucking, bottle, pacifier, whatever shaping your mouth, and your tongue not getting up there, you have less breathing space in your nose because it
yep,
cuts into your space if the palate is high. So, as you go through expansion, whether it's a child or adult expansion, the palate gets wider and flatter, and
mhm.
suddenly you can breathe better. And so it's so fascinating, so interesting. So with the myo and expansion and all that, we get patients breathing better.
Yes, that's the goal.
Yeah,
I've seen that too.
that's
A lot of
cool.
people that got nasal surgery, but they didn't do anything to their palate, and they still can't breathe. So, it does
Right.
matter, so, the recommendations that we give, I mean, it's really only as good as the person who's educated about them, so, you can go to ENTs, and some of them are really fabulous, and they know a lot about what we're talking about, like Dr. Zagi is amazing resource, that we both utilize a lot, but additionally, there's many that have been to other ENTs, especially, like, little children, and they say, "Oh, you're fine," and their tonsils are, like, closing their airway, and, they have a huge tongue tie, so, to encourage some of the listeners, if you think that you may have some of this, but you have been to some people and they say that you're normal, but you still can't nasal breathe, you're still clenching and grinding and some of these things, or maybe your child, isn't they're developing circles under their eyes and clenching at night and doing all of these things. Um, you want to make sure you go to like functional airway people. Really, really important to get those good people. And I know you could probably test to that too.
Absolutely. And you're educated in this, as I am, and either somebody like you or myself, a myofunctional therapist, or someone who's educated in this, can be the quarterback and say, okay, this is what we need to do, this is what we should do. We do this, these are the spokes in the wheel that need to happen, in order to get optimal health and development.
Yes.
So
Yes. Well, I can't
Pretty
believe
cool.
that hour flew by. That always happens.
I
Um,
know it did.
but I just want to thank you for coming on, and for listeners to get more information about yourself, about your services. Can you do like a little plug on ways that they can find you? I will have it in the writing as well. But how do people find you? How do they hear more about this type of therapy?
So, my practice is in La Jolla, California, but I work online virtually and I work in person. So, my website is www.lajolla, LAJOLLAOMT.com. You can reach me at info at lajollaomt. For an email. You can look up Myofunctional Therapy in San Diego. It's strictly all I do. I don't do any type of any other therapies at all. My focus is myofunctional therapy. And call me, text me.
You have social
Where's
media
my?
too, right? You have social media too?
Oh yeah. So I my Instagram, which is kind of fun, it's Myofunctional Therapy LJ. So Myofunctional Therapy LJ. That's my Instagram, and my Facebook is Myofunctional Therapy of La Jolla or Suzanne Robertson.
Awesome. Well, again, we're so thankful. I'm so thankful to have you on today. I hope that you everybody enjoyed this conversation. You go give Suzanne some love, and we'll catch you next time on the Unfiltered Healing Podcast.